Mr. Speaker, let me start by saying, first of all, congratulations to our Vice President and to Minister Ramson on their birthday. And a particular congratulations to the Vice President because he played a major role in getting us where we are today over the dark period of the 5 years that we all know about, that books have already been written about, played a major role in the time when the no confidence motion was passed, the 1 year that the people of Guyana were suffering every day in the field. Mr. Speaker, I take this opportunity to thank the Honorable Minister Dr. Ashni Kumar Singh for his presentation of the 2023 budget. It was a marathon presentation, but every minute of that presentation said something of worth to the Guyanese people. Mr. Speaker, I wholeheartedly support this budget, as I was asked by my constituents in Region 6 to do so. I thank the PPP Civic Government of Guyana for once again preparing and presenting a people's budget, reflective of the consultations that were done with the citizens of Guyana. Sir, please permit me to also thank the staff of the Ministry of Finance for the hard work that they would have done. The staff of the Ministry of Finance do not have a break. They work from budget to budget, one cycle to the next. So I take the opportunity to thank the Minister of Finance and his staff for their continuous hard work and presentations of timely and people-centered budgets. Mr. Speaker, I stand here as the representative of the residents of Region 6 as one of the 2 geographic MPs on this side of the House. It is easy to break and destroy, and that can be done in a short time. The PNC, APNU, AFC, in a few short years, destroyed the good work that the PPP did over 23 years. Even to the end of their term, they decided to throw caution to the wind and try to steal the elections. The COI is revealing some truths. And Mr. Speaker, even those who pretended to be silent, even silence speaks volumes in that case. Mr. Speaker, this PPP civic government has over the last couple of years been building, constructing, and facilitating a growing Guyana. Like my colleague, Yvonne, honorable member, said, quoting back the song and giving it the correct interpretation, onward, upward we are going, Mr. Speaker. The hardships created by the PNC, AFC, APNU is known to everyone in and out of Guyana, but the people of Region 6 were particularly aimed at, and they felt the destructive force of this PNC, APNU, AFC government in every facet of life, whether it be agriculture, drainage and irrigation, healthcare, education delivery, employment. Sir, in every facet of life, the full force of the destructive nature of the APNU AFC was felt. Some examples: loss of thousands of jobs, closure of estates without any plan for alternative employment or source of income for families, destruction of the drainage and irrigation system in Region 6, non-functioning of the National Ophthalmology Hospital. But Mr. Speaker, democracy was salvaged in 2020, thanks to the resilience of the PPP civic leadership and all the freedom-loving citizens of Guyana and our friends from overseas. Books have already been written, Mr. Speaker, about that chapter of our dark history, that dark chapter of our history. And I'm sure more will be written as more truths are revealed. Mr. Speaker, 2022, you wish. 2022 was a good year for Guyana and for my region. There is now an air of expectancy, expectation of good things happening and better things to come. Mr. Speaker, residents of Region 6 see their leaders coming to their villages and towns, walking the streets, visiting their communities, from the chairman, the vice chairman, They see the president, the vice president, the prime minister, or ministers, MPs. They can share their concerns and suggestions directly with them. And Mr. Speaker, they could actually get live photographs with live people and not cardboard men. Mr. Speaker, we all remember the cardboard man. Mr. Speaker, 2022, from the RDC budget, 42 million was spent in drainage and irrigation, 54.4 for bridges, 273 million on road works done in every single NDC in Region 6 and every municipality. 69 million were spent on buildings for education. In health, 891 million was spent for buildings and 74 million on furniture and equipment. Mr. Speaker, the Guyana Marketing Corporation did retrofitting and equipping of agro-processing facility in Blackbush Pola, approximately $150 million. In 2023, they will be doing construction and equipping of agro-processing facility at Crabble Creek, $25 million. Retrofitting and equipping of agro-processing facility in Oriella, $25 million. Mr. Speaker, the GRDB did construct a drying floor at Adventure, $15 million. Rehabilitation work to Lesby Holden seed facility. A dryer will be purchased for the seed facility at Lesby Holden. Total of 788 farmers benefited from flood relief assistance to the tune of $833+ million. Biofortified and other research projects valuing approximately $6.5 million ongoing at the GRDB substation in Lesby Holden. Low-yielding farmers project initiated where GRDB extension officers are required to provide and support 10 farmers who experience low yields. Mr. Speaker, the list is long. Mr. Speaker, the National Agriculture Research and Extension Institute also played a part in 2022 in Region 6, providing coconut seedlings, fertilizer, limestone, vegetable seedlings, insecticides, treatment for Akushi ants, knapsack, pumps, shade houses. Mr. Speaker, I have the list here if anybody is interested. Farmers were also trained. 460 farmers benefited. Their distribution of beneficiary packages for the Food and Agriculture Organization Emergency Response and 130 smallholder farmers benefited from Region 6. Mr. Speaker, the National DNI Authority also spent monies in a total of 93 projects that dealt with drainage and irrigation, that dealt with the livelihoods of farmers in Region 6. Mr. Speaker, for 2023, the region has budgeted $71.5 million for DNI, $54 million for bridges, $300 million for roads, $289 million education delivery, and $294.8 million for the health services. Again, Mr. Speaker, these monies will be spent across the entire region. Mr. Speaker, to help persons who are unemployed, 4,000 part-time jobs are made available, and 4,000 persons in Region 6 are now getting employment as part-time workers. But more, Mr. Speaker, these part-time workers, whilst they're earning, also have the possibility of studying. And I know of a relatively large number of young persons in my region who are doing the part-time job and who would have also gotten gold scholarships. So they're working and studying, and that is also a possibility in Guyana now, Mr. Speaker. Mr. Speaker, Minister Parag spoke about the gold scholarship and how it's being given. This people-centered government will not tell our young people that government does not provide jobs. We will empower our young people. We provide opportunities for them to grow, to study, and to earn. Mr. Speaker, I would have heard comments about the budget. I would have heard comments about the figures and the language and whatever. But Mr. Speaker, I'm not surprised, unlike my colleague, Honorable Member Pearson. I'm not surprised. We all know that those sitting on the opposite side of this House, again, I would say except the Honorable Deputy Speaker, they got a problem with maths. Remember the 32.5 man? Mr. Speaker, they also have a problem with English. And they budget is all about figures and English. If they have a problem with that, then how can they understand what is the direction the budget is going? How can they understand help that people will be getting? How can they understand the impact that this budget is going to have on every life, on every single person living in Guyana? Mr. Speaker, it's not only about how much money the pensioners will get, it is also about what we would have done before. They put VAT, they remove subsidies. We remove the VAT and we give back the subsidies. This people of Guyana across the entire country. Mr. Speaker, health in Region 6. Outreaches were done in Oriala, Siparuta, Baracara, Mara, and in specialist outreaches were done in the health centers on the East Bank and other health centers along the coast. Specialists visited on a rostered basis all 3 district hospitals, Skeldon, Maibikuri, and Port Moran, and provided service. Geriatric homes were visited regularly along with the orphanages that are in the region. And Mr. Speaker, the home-based care program 2009, and which was going very well, and which was stopped by the APNO AFC government in 2015, has restarted. Mr. Speaker, there are 1,000 persons in Region 6, and that was also stopped, has again started, and 1,000 persons plus in Region 6 has benefited in 2022. And I'll speak about that a bit. Speaker, let's talk about the ophthalmology hospital. It will take me into the work of the Ministry of Health, and I am a part of the staff of the Ministry of Health under the leadership of Honorable Minister Frank Anthony. Mr. Speaker, the Ministry of Health has taken charge. The leadership of the Ministry of Health has taken charge, and we are where it is now and to a brighter future. Mr. Speaker, the management has improved and continues to improve. Confidence is growing in the healthcare system. And here, Mr. Speaker, I want to say thanks to the President and the government of Guyana, to the Ministry of Finance for the monies that they have allotted to the healthcare workers. The increase in salary their lives, Mr. Speaker. Mr. Speaker, in my region, the National Ophthalmology Hospital has been reopened and is functioning once again after not functioning under the APNO AFC. It took a large investment to bring it to a state of readiness, to be able to do surgeries. Equipment were not working. Fungus was on the walls of the theater, Mr. Speaker, and anybody who has a modicum of knowledge of surgery knows that that is critical. They had infrastructure issues. The roof was leaking. Mr. Speaker, once again, that facility is fully functional. Surgery started this year on February 14. They started doing laser for the retinopathy patients. They started school screening in the primary and secondary schools. Cataracts were operated on. Cataract patients were operated on. Retina patients with bleeding now have access to laser therapy. Ultrasound for patients with bleeding at the back of the eye. These patients used to be referred overseas, and bleeding secondary to trauma are now available. Outreach was done to all the remote areas in Region 6 by the ophthalmology staff and refers to GPHC or limited. Mr. Speaker, in 2022, a total of 1,769 surgeries were done in the National Ophthalmology Hospital, a hospital that didn't do surgeries in the years prior to that. Mr. Speaker, I just want, Minister is prompting me, I just want to say also, I want to touch you about the hinterland, health services in the hinterland. But before I go there, Mr. Speaker, the elderly care program that started in 2009 and, like I said, was stopped. But last year, it was for 2022, it was expanded, and now it's in regions 2, 3, 5, 6, and 9. and a total of 6,300 odd persons, geriatric patients, benefited from that program across these regions, Mr. Speaker. Mr. Speaker, I heard the honorable member from Region 1 talking about Region 1. And the only thing I heard him mention is Mabaruma, and I just want to advise the honorable member that Region 1 is a lot more than Mabaruma. A lot more than Mabaruma. And I heard him say that the honorable member, Minister Colin Crowell, spoke about visited only Mabaruma and talked to people in Mabaruma. That was the impression that he was giving. Mr. Speaker, I personally visited, out of the 50 facilities, primary healthcare facilities that we have there, I visited 44 in those communities. And I could tell you in each one of those communities that I went, people were speaking about Minister Crowell's visits. He would have visited over 90% of these facilities, Mr. Speaker.
Before you could get to the 10% more, you'll have to get an extension.
Mr. Speaker, may the honourable member have 5 minutes to conclude.
Thank you, honourable member. You may continue.
The major achievements in Region 1, Mr. Speaker. They have started training for the first time. Nursing assistants are being trained there. And Mr. Speaker, across the country, we would have nearly doubled the number of community health workers. They have 6 dormant, non-functional facilities were reactivated, including Blackwater, Savannah, Barbina, 5-Star, Cookrit, Taswini, and St. Aslim. Mr. Speaker, I invite the member to visit these facilities. 10 facilities that never had community health workers that were there but non-functional because they didn't have staff, now have 2 community health workers each. Screening for eye problems are done. And Mr. Speaker, as we speak, patients from Region 1 are getting surgeries in the National Ophthalmology Hospital, the same hospital that was non-functional under the APNO AFC. Mr. Speaker, the Maruka Hospital. The Maruka Hospital now has a functioning theater, and over 60 patients have already had surgeries in the operating theater in Maruka. Mr. Speaker, they also have ultrasound facilities and X-ray. Mr. Speaker, 100% of those primary health care facilities have better services and provide more diagnostics. If we look at Region 9, Mr. Speaker, they would have also had decentralized training. They would have also had, for the first time, training being done in the region for nursing assistants, for pharmacy assistants. They'll be starting training for medical technicians, Mr. Speaker, scrub technicians. We are building Guyana, Mr. Speaker, one day at a time. They did specialist outreaches in every single health facility in Region 9. In most of these facilities, there were 2 specialist outreaches. They provided obstetric and gynae care. They provided ultrasound in the villages for the first time, Mr. Speaker. All pregnant women would have had at least 1, in most cases 2 and 3 ultrasounds during the course of their pregnancy. Never happened before, Mr. Speaker, never. And Mr. Speaker, we screened 60 patients from Region 9. We brought them out. We got their surgeries done at the National Ophthalmology Hospital, and we took them back, including members from the opposition and relatives. Mr. Speaker, we also have another project that the minister, a brainchild of the Minister of Health. Mr. Speaker, the Snap-on Spectacle Project, I'm sure the minister will speak about it, but I need to say, when he told me about that project, I had my doubts. But Mr. Speaker, when I see the school children, benefiting from these spectacles, they come, they get their eyes tested, and they leave with prescription glasses. Mr. Speaker, it was a sight to behold, and that is going to continue. Mr. Speaker, the coalition never take care of me. The coalition kicked me out of my job. Remember that. Mr. Speaker, there is improved diagnostics in radiology. There are more vehicles that have been distributed. Mr. Speaker, theater In Region 7, Camarang, that theater is soon to be functional. Within next month, we'll start doing surgeries there. In Aishalton, first week next month, surgeries will be starting there for those residents. Mr. Speaker, Mahadeo, the theater in Mahadeo is soon going to be functional. The theater in Maikoni that never worked has been doing surgery since last year, Mr. Speaker. Mr. Speaker, there is rehab therapists in all regions of Guyana now. Previously, they were not in all the regions. Mr. Speaker, in wrapping up, I want to say that betrayal of trust is never a good thing. When an individual is betrayed, the individual loses trust and faith in the person who betrayed the individual. Mr. Speaker, our nation was betrayed when they put their trust in the APNU AFC. The good life was promised, but only a few in the hierarchy benefited, living the good life with gifts and other perks. The nation was betrayed and will not trust this group again. You will not only be there for a long time, Mr. Maipol, but your numbers will also dwindle come the next election. Maybe this is why you're afraid to go to local government election. Your numbers will then dwindle, and as your numbers decrease over there, our numbers will increase over here. Mr. Speaker, so learn to be a good opposition. Learn to be a good opposition. You're there for a long, long time. Mr. Speaker, like His Excellency said, this is a transformative budget. It will take long to build, to cultivate, to mold, and to develop an individual, and even longer to develop a country and a nation. And it is achieved with a lot of hard work, effort, discipline, trust, and of course, the necessary financing. And the budget is providing us with the financing. The government has to stay rooted with its people. President, Vice President, Prime Minister, ministers, and MPs must walk with the people, meet with the people, listen to them. And that is what this government is doing. Mr. Speaker, this budget provides the financing and the framework to further develop Guyana, to further transition this dear land of ours to its true potential. This budget, Mr. Speaker, indeed has something for everyone. This budget, Mr. Speaker, is taking one more step towards the bright future Guyana deserves. Thank you.
Much honorable member.